Good afternoon, ladies and gentlemen. The webinar is beginning. My name is Chris Wilson. I'm the Communications Director here at the DFW Hospital Council. Normally, my CEO, Steve Love, would be here providing the intro. He was called away to a business meeting, and he's very disappointed. We kind of have an all-star lineup of speakers here, but he does send his apologies. Thank you for being here for this webinar. It's hosted in coordination with Protiviti. They are an associate member of the council. Today's topic is 2024 Healthcare Industry's Top Risks. Protiviti is a global consulting firm providing solutions that span critical business problems in technology, business process, analytics, risk, compliance, transactions, and internal audit. Today, these national executives, and this is really just a great lineup of speakers, will detail the most pressing healthcare industry risk on the horizon and what they mean for your organization. Our speakers today are Richard Williams, Managing Director, Global Healthcare Practice Leader, Leyla Erkan, Managing Director, Healthcare Compliance, Kimberly Lanier, Managing Director, Talent Advisory, Bryan Throckmorton, Managing Director, Digital Strategy and Transformation Lead, Jarod Baccus, Director, Healthcare Internal Audit, Kevin Dunnahoo, Director, Healthcare IT, Cybersecurity and Digital, Bryan Neaman, Director, Healthcare East Region Lead, and Kim Pardini-Kiely, Associate Director, Healthcare Operational and Clinical Excellence. We are looking forward to their presentation. An added note, we will be taking your questions. Just type them into the chat box, or if you'd like your questions to be private, type them into the Q&A box. And with that, ladies and gentlemen, here's Richard Williams.
Thank you, Chris, and hello, everyone. I'd like to extend a sincere welcome to today's webinar where we'll discuss an annual study that we conduct to identify the healthcare industry's top risk. As Chris mentioned, my name is Richard Williams with Protiviti, and I'll be moderating today's presentation. We're glad that you're here, and we certainly hope that you find the material meaningful and insightful. And for those interested, CPE credit is available for this live version of the webinar. By attending today and responding to at least 3 of the 5 polling questions, you will receive 1 CPE credit. If for some reason you experience technical difficulties when answering the polling questions, you may also provide your answers in the chat section. CPE certificates will be emailed to eligible participants from Protiviti within 60 days. So with that, let's now review our agenda for today's presentation. As you can see here, we'll start with an overview of the survey results, and then we'll work our way through the material according to the 5 themes, which I'll describe more momentarily, that we built the presentation around. And with any time remaining, of course, we'll address questions that you have submitted via the Q&A section or the chat feature as time permits. So now let's proceed forward to review the top 10 risks in this year's study. Now I'll give you a moment to peruse the list and offer a little background on the study and a few key takeaways. The study is performed in conjunction with the North Carolina State Enterprise Risk Management Initiative, and the respondents, which by the way are largely C-suite executives and board members, are asked to rank 36 different risks across macroeconomic, strategic, and operational dimensions. As mentioned, we do this annually, and I'll try to compare and contrast how this year's results compared to last year's, etc. And we will continue this study into 2025 as well. And then you'll note, if you're looking here and reading what's on the slide, you'll note that we not only surveyed the respondents for their view on the top risk for 2024, but also for the top risk looking out 10 years for 2034. So you can see in parens at the end of each risk how it ranked for 2034. And at the end of this presentation, we'll show you both lists independently. Now, a little bit as for year-over-year trending and comparison, many of these top 10 risks are similar to last year's results. We don't usually see a material change from one year to the next, but this year in particular we did. We had several move up or down slightly, but new to this year's list is number 6, third-party risk, and number 10, the interest rate environment. The risk, no surprise to this group, I'm sure, but the risk that fell out of the top 10 from 2023 when conducting this year's results were pandemic related. Specifically, two risks, one tied to concerns that were tied to government policies in response to the pandemic. And no surprise, in 2023, a top risk or concern was everyone's confidence as it related to managing a remote workforce. That risk has fallen out of the top 10 for 2024. And then finally, to make the discussion and what the presenters will share with you throughout this presentation, we've organized the top 10 risk into 5 themes, which you can see here on the right side of the page, between workforce, economic, compliance and privacy, technology and cyber, and then finally digital and innovation. This is how our presenters will speak to the results. So now with that, let's move forward and begin a discussion of the risks that align to the workforce theme. Kim, it's all yours.
Thank you so much. It's so unusual to have two Kims, but here we are. So I'm going to start. I'm Kim Pardini-Kiely. I'm a nurse, but I've been a C-level executive for hospitals, health systems, and academic centers in my past. So I know this area well and really look forward to discussing it in greater detail. So with that, next slide, please. It's no surprise. Oh, we're going to start with the polling question. Sorry about that. So here we are. The polling question is based upon your experience. Which of the following is the most relevant workforce related challenge for your organization? And there are 4 areas.
Going to be
Chris,
hard
are you
to
able
pick,
to-
I think.
There we go.
There,
It should
thank
be in
you.
your chat function there.
Hiring, skill sets, shortages, and market competitiveness. And we'll just take another minute or so.
We're seeing a pretty wide variety across the 4.
Yeah, yeah. So really looks like it's important to address all of these areas, which is great because that's actually what we're going to talk about. So now we can move on to that next slide. And I think it goes without saying that these 2 areas, the increase in labor costs, as well as recruitment and retention, are most definitely top of mind for the healthcare industry. So what do we do about that? Well, we're going to go through the workforce management processes that we think are important for any organization to address. So with that, if Jarod, you'd move on, please. We've organized this into really 6 key areas, and the discussion is really going to be about what are the areas that should be addressed in each of those key areas of focus. So let me start with really streamlining hiring processes. This is a common pain point. I'm sure I don't need to tell any of you that for healthcare organizations. It's often complicated, and I think the biggest area of struggle is that it can be a very lengthy process, and that is the most frequent reason cited for losing candidates, which is very frustrating, obviously, for your management team. We'll explore, because it's so important on the recruitment and retention side, Kim Lanier is going to explore this in much greater detail. So we'll dive into that in just a little bit. Cost, right? The highest industry risk is really increases in labor costs. It's really essential to address that, to revisit the re-engineering, the redoing of your existing staffing models, and really ensuring that your licensed practitioners, often your highest paid workers, are really working at their top of their license. In all of these areas, despite it being either clinical or non-clinical, it is important to consider the use of technology to really augment or replace the manual processes. Using technology can be a real advantage in lowering labor expenses. I want to just point out something that I think is a very important helpful aid for you. The American Hospital Association put out a piece on strengthening the healthcare workforce in 2022. It's a great resource. If you've not had a chance to look at it and are really interested in workforce management, I highly recommend you check that out. Being the employer of choice is really knowing about what your employees value and really creating an engaging environment where people feel heard, importantly appreciated. It is, I think, important to also recognize that culture plays an essential part of this. And healthcare is a team sport these days. So really working with your employees on teamwork pays off. And the reality is that the more that you can promote teamwork, the better people feel about the work that they do. Balancing remote versus online scheduling is another area to look at, really planning for what is that balance. We all know that everybody has really enjoyed their time away, working from home, and yet there are important needs to bring people back. So I think, again, just balancing that is going to be essential. A robust diversity and inclusion strategy can also help support the workforce and the communities that all of you serve. The next area is around retention. Of course, one needs to offer competitive salaries, but in addition to having a well-coordinated onboarding process is really, I think, critical because you want to get your employees off on the right foot. It is the first year or two where the most attrition typically happens. And as time goes on, career advancement takes center stage, as well as employee well-being. And this is becoming, I think, a more common topic than ever before. Just recently read an article where 93% of all healthcare workers report high levels of stress. 86% anxiety, and 75%, that's 3 in 4 people report that they are burnt out. And yet at the same time, only 13% of healthcare workers report that they have access to behavioral health services to help them through these processes. So again, this needs to be an important part of a strategic plan on workforce management. As regarding skills, identifying the skills needed to really optimize operations and to provide training and education is important to meet the needs of your workforce. I mentioned the importance of team-based models, and I think the more that you can promote that in the areas in which people are practicing is an important approach for really creating that esprit de corps. Succession planning is often perceived as a luxury, but it really is a tool or process that is really dependent on creating what you want in the future of your organization. So succession plans should be continuous on an annual basis and be clear about the criteria and attributes you want. Finally, total rewards. This area needs to reflect both financial and non-financial incentives. So with that, I'm going to turn it over to Kim to give us a little bit more granular details in some of these important aspects.
Thank you, Kim. Many of you out there from different hospital systems are saying, are probably nodding your head saying, yes, all these things apply to us. And one of your questions might be, how can we wrap our arms around this? How can we create solutions? One of the things that we find useful is assessing the ability to attract and retain the workforce holistically. And what you see here before you is a taxonomy. And on the left-hand side, you see different categories around it, being able to attract top talent. Things like managing your employment brand. Kim talked a little bit about the employment value proposition, but there's more to it than just the value proposition. You need to be managing and monitoring your employer reputation, making sure that you have the right credentials as a great place to work, and monitoring things like your employment net promoter score, and make sure and have more of a holistic talent marketing strategy. Also being able to do things across talent forecasting, talent marketing, talent acquisition. There's a lot of different moving parts and pieces that go into being able to attract strong candidates, and part of that both across both sides of the model here is we're seeing more and more healthcare organizations take a step back and kind of redesign work both on the clinical side and the non-clinical side. There's been so much advance with new digital skills, technical skills, artificial intelligence. Is there a way to kind of redesign work to make sure that everyone is leveraged up against the strongest aspect of their value, their talent, and their skills? And that's why, if you look on the right side of this from a retention side and engagement side, there is so much more emphasis on skills and linking skills to things like career pathways and more targeted rather than general skilling events. Those types of activities and capabilities inside an organization can really target the burnout issue that Kim raised just a few moments ago. So I know this is a lot to absorb, but having a taxonomy to help guide you, to guide your strategies, to guide your plans in terms of leveling up these types of capabilities across your organization can be really, really helpful. And there's probably some things here that could be added or taken away based on your organization, but having a blueprint like this can help you put together the right roadmap for your organization. So at this point, I'm going to turn it over to Bryan to talk a little bit more about the economic impact.
Thank you, Kim, and good afternoon, everybody. And thanks, Chris, for the introduction. So once again, I'm Bryan Neaman with Protiviti, and one of my primary roles is really working with executives throughout the country, CFOs, COOs, CEOs, advising them on what we're seeing nationally from an economic perspective, and the impact on healthcare organizations nationally. So with that, if we can go to the next polling question, thank you. So polling question 2, relative to economic conditions as well as the interest rate environment, we'll talk about that as well. What's your organization? We'll ask the attendees on the call. What's your organization's top short-term economic financial performance concerns? And you'll see the options here between labor shortage, inflation, supply chain, declining reimbursement, competition, then F, increase in regulation. There could probably be an option G, all the above. So maybe we could have added that as well. But I think be curious on the responses here for this one. I'm looking through the chat. Reimbursement. Like reimbursement is labor shortage is showing up as well, and inflation, supply chain shortages. Looks like late decline reimbursements tends to be a little bit higher, but nonetheless, I mean, all these are relevant, of course, as we appreciate. So we appreciate that. Yeah.
Hey, so this is Richard. I just wanted to highlight for you. You'll recall we had probably about, I don't know, a little over 1,000 different respondents respond to this same question in our results, and the comparing and contrasting to the answers given then, this was just a few months ago, labor shortage was top of the list pretty substantially, correct? And then that
It was.
correlates back to what Kim and Kim just presented with, and an overlap to the top risk. And then declining reimbursement was, second in
It was.
relation to these on the list here. So just by way of comparing and contrasting to a larger group and audience, that's kind of how they compare to the results here today. And you can see those were the two that showed up as your number one and number two today as well, just flip flop.
Exactly. Yeah, thank you, Richard. Yeah, and I think the nature of our survey, we did this in the fall of 2023, so there's been a little bit of time since then, but interesting, a little bit of the change there. Reimbursement now is number one for this attendee audience versus labor, but still all relevant for sure. So what we'll talk about a little bit with a little bit more detail as it relates to economic conditions and interest rate environment is just kind of, yeah, I think that this group appreciates the risk, and we'll talk a little bit about what those risks mean, but equally important, what are some of the strategies we're seeing healthcare providers throughout the country doing to address these risks? But I think what we all appreciate is from an economic perspective, and specifically margin performance. There's really there's a few drivers to it, and that's really reflected in the poll that we just shared with you on the slide. And I think when we think about labor, Kim and Kim spoke about that, but the other pieces to it include certainly inflation and supply costs, both from pharmaceutical perspective as well as supplies. And then the other piece to it too is just the capital and credit markets. With the higher interest rates, access to capital, what does that mean for providers in terms of having liquidity resources to help manage their provider environments on an ongoing basis to provide ongoing care and patient access. So when we think about healthcare as overall, I think we can all appreciate that healthcare is roughly 20% of GDP. So a really central, critical part of society for the nation. And so what are we seeing from a healthcare provider perspective in terms of how they're addressing these economic conditions today? So let me just speak to a few things that we're seeing right now. One is around performance improvement. Performance improvement obviously has always been part of really part of the activity for every healthcare provider throughout the country. What has happened recently, at least over the past couple years, is there's been more intentionality around aligning clinical initiatives with financial improvement initiatives, specifically around patient access and care delivery, and then leveraging automation technologies into that. And that's really been a real value-oriented exercise, both on the clinical side and the financial performance side as well. And it's certainly what's really driving a lot of that is technology and automation, and we'll talk about that later. But that's something that we see that's really generating a lot of return financially, and specifically those service lines that tend to have high volume and high dollar services. And we can use cath lab as an example, and the charge capture piece associated with it, kind of making sure there's great oversight and marrying the clinical side and the revenue integrity side and finance side as well. On the growth side, most organizations are very open and interested in alliances, whether it's joint venture partners to provide services that maybe they didn't have before, or to have a further reach into a community they did not have before. So the joint venture environment is really, really, I would say, accelerating more than we've seen over the past few years. And there's a lot of what we would describe as non-traditional players who typically had not been part of healthcare before, who are now entering the market to really find those niche needs and services. And then on the acquisition side, certainly some organizations, based on how they're situated in their geography, recognizing that for growth to transpire, seeking another partner to help them on the journey is a strategy that's happening also. As it relates to third parties, there's a lot of organizations out there, consulting firms, niche providers out there who are willing to kind of take a function off the provider's plate in terms of outsourcing those areas. Revenue cycle is an example of that in particular. and some of the other back office operations. And I think generally that tends to be a valuable type of scenario relationship for providers for a couple different reasons. One of which is it helps improve financial performance, whether it's cost reduction or improve cash flow and revenue. Equally important, it brings another level of expertise that some providers have been challenged to kind of maintain internally based on some of the labor challenges Kim spoke to previously. Another creative thing we have seen to help manage some of the economic challenges is some kind of new nuanced supplier relationship models. And what I mean by that is some suppliers out there are very open and interested in working with providers to work through scenarios where, for example, if you're working with an imaging company, and imaging equipment, rather than procuring the imaging equipment, as an example, some of these suppliers are willing to basically let you, it's almost pay as you go as you use those imaging machines and services, kind of being paid by the unit versus paying for the imaging hardware on the front end. So that's been something that we've seen recently as well. And then on the labor side, just to add a little bit more to what Kim said, I think certainly some of the organizations and clients I have worked with and our team has worked with, there's even more openness to flexible staffing models, particularly on the clinical side. And I think it's really a win-win for everybody. From a clinician perspective, there's many clinicians out there who are more open to flexible models, kind of work when they're available based on their lifestyles, their personal interest. And kind of laying out a scenario where increasing that level of optionality for those teams really helps provide both clinician oversight and delivery, but also helping manage the cost, because typically those models are less costly than a full-time complement. And then the other thing we have seen a couple of things real quick is on the automation side. There's no doubt automation will continue to accelerate within the healthcare provider environment. There are so many vendors out there who have automation technology. EMR programs, Epic as an example, have a lot of automation technology as well, to support the delivery of healthcare. And really the willingness and an appetite for organizations to both train their teams, leverage it, and then help improve healthcare delivery. It not just provides better quality care, but helps improve the financial performance of the organization also. And then lastly, the last comment I guess I would make, recognizing the time, is as we think about looking ahead for providers and we think about economic conditions, there's some good news and then things to consider. I think the good news is when we look at the population growth projections between now and the next 30 years per the CBO, it's projected that at least in the U.S., the U.S. population is going to go from roughly 342 million today to 383 million in 2054 over 30 years. And of that group, it's going to be roughly 22% millennials and then 21% Gen Z. So why does that matter? Well, one of which is they're going to be buyers in our economy going forward. They're going to be heavy users of the healthcare delivery system, and they're going to be strong advocates and willingness to use digital technology for their healthcare needs. So those are all good reasons for healthcare organizations to really get ready for the digital revolution in the healthcare environment, recognizing that those contingents will be really using that for selecting care, scheduling care, discriminating on who they use, physicians or providers, et cetera. So a lot of optimism going forward. I think short term, from an economic perspective, organizations are really right sizing and being agile to what the environment means. There's a lot to think about on a go forward basis as well from an economic perspective. So with that, I'll pause there and transition to Leyla and Jarod.
Hey everybody, nice to be with you today. Leyla Erkan. Prior to leading the risk and compliance practice for Protiviti, I spent almost 20 years serving in the capacity of compliance, privacy, and research officer for systems here in Chicago. So with that, if we could go to the next polling question. So this is obviously related to compliance and privacy. And the question is, what is lacking for your compliance program to be most effective and stay on top of enforcement? We've got people and talent, understanding rules and regulations and risks, technology, data and analytics, and then my favorite, nothing, because everyone has very effective compliance programs. So let's see what the results are. So it looks as though, if I'm seeing this, and of course, let me see. Wow, this looks pretty even if I'm looking at this right. Emerging regs, technology, data and analytics, which is pretty consistent with what we see. I think regardless of what it is, the challenge is certainly keeping up with and managing the pace and complexities around compliance. Obviously, many organizations struggle with this, given staffing constraints. You couple that with, the lack of technology, legacy systems, and also given all the regulations, you need specific SMEs, and you also want generalists. So that's just adding a level of complexity. And then just add on top of that, trying to be more effective and efficient with analytics. It's just frankly getting harder to comply. So let me just jump in as it relates to heightened regulatory changes and scrutiny, and I'll also include privacy and then hand it over to Jarod to spend a few minutes on third-party risks. But at a high level, we are seeing a lot more cross-collaboration with different agencies from a federal, state, and local level. It's going to very likely continue to rise, especially as data and analytics, AI is becoming much more sophisticated. So it's just putting a lot more clout on enforcement because different jurisdictions are much more easily able to work together. And the government is becoming much more smarter and data rich in its efforts. In fact, a few weeks ago, there was a huge announcement by the Department of Justice, and it was called the National Healthcare Fraud Enforcement Action, very large scale cross-agency collaboration, criminal charges against almost 200 individuals, $2.75 billion in false claims, predominantly related to physicians, nurse practitioners. It was everything from unlawful prescribing of drugs like Adderall, HIV drugs, telemedicine schemes, you name it. We're just going to see a lot more enforcement, especially also because we've seen the federal budget contains a lot more greater funding than it has in prior years related to enforcement. In fact, we've seen about, I would say, 15 to 20% increase for a number of the key agencies, and we anticipate more. And despite that funding, the HHS Inspector General said a few months ago when trying to plan for 25 budget that they have anywhere from 300 to 400 criminal and civil fraud cases every year that they just can't get to because of staffing. And in fact, in addition to that, what I found really alarming is that they are turning down half of the referrals from federal and state CMS contractors because they just can't get to it. And we all know enforcement and dollars from a federal perspective are going to change because it's an election year. And interestingly, a data point is that the return on investment over the last few years is that for every dollar that the government is spending on enforcement, they're getting a return of $2.90. Pre-COVID, it was about $4.20. And then in about 2013, 2015, prior to that, it was about $6.10. I do think we're going to get back to that return for the government. I think it's going to be in a few more years. But I think the moral of the story is that more money is being given to enforcement, and we're going to see a lot more of it. So let me just quickly get into just a few priority areas given my time that I want to make sure that you all are aware of. Last November, the OIG, the Office of Inspector General, put out a voluntary guidance that discusses general compliance risks around how to have an effective compliance program. We are seeing a significant amount of activity around assessing and implementing this guidance. And this is big news because it's been 20 years since the last version of this guidance. So, and this guidance is very much what compliance officers, privacy officers, risk officers breathe on a daily basis. And there's three areas to really that people are focusing on. One is around compliance's increased coverage of quality and safety, which really hasn't happened historically. The second is around having a much more robust risk assessment, including quality and safety. And then a significant expansion of duties and responsibilities of compliance committees. And in addition to the general guidance, we're going to be seeing this year additional guidance by the OIG that's more industry segment specific. And we're going to see Medicare Advantage plans and nursing facilities. And then after that, next year, we're going to be seeing hospitals and clinical laboratories. So now is a great time for organizations to be assessing their compliance program. Now, let me go to privacy quickly. I mean, when we talk to compliance and privacy officers, I mean, the challenge, and I don't think this is going to be a surprise, is that organizations really don't have a sense of all the data that's being collected, for what purposes, where is it stored, who has access, and with whom it's being shared with. Then, of course, once you have that inventory, the question is, okay, well, what are the risks? There's a number of privacy risks, and there's a number of things that we want to be mindful of related to privacy, because we're going to see so much more privacy related rules as it relates to AI, also as it relates to cyber attacks. A few things. OCR provided some controversial newer guidance as it relates to the use of patient member data with deploying tracking technologies on both public-facing websites and portals. You've probably heard of the number of hospital lawsuits that's going on with metapixels. OCR is essentially saying it's considered sharing of PHI. And then a few weeks ago, a Texas federal judge actually ruled that the key portions of that guidance from the OCR is unlawful and exceeded the scope of OCR's authority. OCR also announced that they'll be kicking off another industry-wide audit program. They haven't done this since 2017. There's also new HIPAA privacy rules that are proposed, about 400 pages worth. A lot of focus is on release of information, patient access, rights to access to information. There's also an OCR right to access initiative, which began in 2019, well over 40 settlements. It's going to be a huge area. Also relates to information blocking rules, which we expect that enforcement to start actually at the end of this month. And so many organizations are using third parties when it relates to release of information. So now's a really great time for organizations to look at their third party vendors, including as it relates to release of information. Business associates is going to be an area of focus when the OCR does its pilot audits. So again, something to be mindful of. So with that, let me pass it over to Jarod to talk third-party risk.
Thanks, Leyla. Yeah, and for those of y'all that know me, my name is Jarod Baccus. I work with a lot of executive leaders across the healthcare space on some of their operations and risk mitigation. And what we're talking about here is third-party risk. Came in at number 6 this year. I think people saw in the future it would be number 5. However, I do think when the next survey comes out, it will be much higher, especially after everything that's happened with the Change Healthcare breach and the previous Kronos breach. The key things for third-party risk you want to kind of think about is, what are we looking at? Are we looking at vendors during their entire life cycle? From a business relationship and how it started and managed through the time period they're working with your organization, and to monitoring how those vendors over that duration of the contract change their operations. Are they taking on additional risk? Making sure you have the appropriate protections in place upon the contract termination is key, so that those vendors don't keep access still sitting out there. And Kevin will talk about some cybersecurity being a key component of that coming up in the next section. But we also want to kind of make sure, as you think about third-party risk, you're thinking about all the key groups that are involved within it. So you're looking at, patient data security protections, compliance, as Leyla just mentioned, medical device security and patient safety from patches and maintenance, health information dissemination. If organizations or third-party vendors are, reporting to the government or regulatory agencies and payers on your behalf. Obviously, revenue cycle is a big one, especially as the way things came out of the Change Healthcare breach. And as you look at your vendors, do you only have one vendor performing a service for you? What happens if you're fully reliant on them and they go down? Do you have backup vendors that you can put into place and call upon to have coverage while they are down? So just all a bunch of good things to consider as you're looking at your third-party vendors that you're doing business with on a day-to-day basis. And with that, I will turn it over to Kevin. Go ahead, Richard.
Jarod, yeah, Kevin, before you take over, I think it's worth mentioning and highlighting and emphasizing that this regulatory environment will have a substantial impact by the Supreme Court Chevron ruling. That landmark ruling, as you all have probably read and heard, could make it really hard for executive agencies to tackle a wide array of policy areas, and that would include environmental, health, labor, employment, and not just specific to healthcare, but other industries too. So more to be developed and communicated in that regard. And I think that will have a big impact on survey results whenever we come back and share the results for 2025. So now with that, Kevin, please now take over.
Thanks, Richard and Jarod. Kevin Dunnahoo here. I've had the pleasure of working with many healthcare providers across the country assess and improve their technology and cybersecurity programs. So with that, let's jump into our next polling question. All right, this one's pretty straightforward. What level of confidence do you have in your cybersecurity measures to safeguard your environment in today's day and age with all these breaches we're starting to see? So you should see that pop up now in the chat, so you can go ahead and put your answers in. While those are being populated, you know, the key things that we're seeing, you can't hardly open a headlines these days without seeing anything regarding all these breaches occurring between Change Healthcare, Ascension, Lori Children's. It is, you know, significant in terms of the amount that our industry is getting targeted right now, in how we're able to deal with that. As I'm seeing some of these answers come in, it's similar to some of the prior polling questions we did, about a 50% moderate confidence and 10% low. Surprisingly, 40% high. That's great to see. It kind of depends on what attack vectors we're starting to see, whether or not organizations are really prepared for that. So thank you all for your input to that. And with that, we'll jump into a little bit more discussion on this theme. It's important to note that cyber threats were rated as a 5th highest risk, but as the respondents looked out at 2034, it was the first rated risk on their radar. And with all of these recent impacts that we've seen, I expect in our next survey that this is going to be likely number 1 again, just within the industry. Those organizations that we're working with on a regular basis to see kind of, hey, how are they improving? What are they doing? How are they addressing this trend? A lot of them have started to increase the amount of testing they're doing of their own organization, penetration testing on a regular basis, social engineering testing, truly acting like these attackers, using their same techniques and tactics and seeing, can we actually identify and respond to these things in real time? Looking at control consistency within our healthcare provider organizations, we still have a lot of dispersed IT functions, whether that's marketing, finance, or your radiology, laboratory, pharmacy, biomedical engineering. There are different owners of those controls, and how are we able to ensure that they're being performed consistently is a key consideration in looking at that. Jarod mentioned third-party risks, and really one thing to keep in mind is it's not just vendors. Vendors get a lot of our focus when we talk about third parties, but joint ventures, partnerships, things that we are engaging with that may actually open up new attack vectors are some things that we need to consider in terms of our security program. Education is key. We got to make sure that everyone understands that cybersecurity is a key essential part of their job responsibility, regardless of their job title. It's from everybody from, you know, nurses and care delivery all the way up to our senior executives. Attackers do not care how they get a foothold. They just want a foothold, and they can really start creating havoc once they do. Cyber insurance continues to get a lot of focus, and we do see that increasing in cost. But we also see a key clause within these cyber insurance policies where if it's an act of war, the policy may not pay out on your claim. Where we see like a Change Healthcare that is directly attributable to a foreign state actor, which was a hacker group in Russia, these clauses may come to bear. So don't expect that these cyber insurance policies to meet all the needs that you may have. Looking at the 8th risk on this list, we've seen some challengers come and start to kind of go when we talk about the born digital competitors, with the Walmarts of the world now kind of closing up some of the shop. But this still kind of points to the need of us having to ensure that we've got a really robust IT environment to respond to the latest challenges of our organization and take be able to use the latest technology advancements like AI to really advance our processes. So make sure that you're planning to replace those legacy and aging IT systems on a regular basis to make sure that we can actually optimize our environments at the end of the day. And with that, I'll turn it over to Bryan to round us out with our last theme.
Hey, thanks, Kevin. Much appreciated. Bryan Throckmorton here, everybody. All day, every day, focused on digital transformation. So let's get right into it with the poll question. Does your organization have a formalized governance committee or a similar group in place to oversee digital initiatives? So while you're giving that a look, interested in to see what you guys are coming up with. But it'll be as no surprise to anyone on this call that digital transformation is alive and well in the healthcare space. And that's part of the risk that we're going to talk about today is just the risk of the skills available to deploy all these digital technologies. Because as most of you know, unfortunately, you can't just open up the digital technology. It's going to implement itself and get you off and running. It's going to actually take some skills to optimize that. So looks like most do. They've got a dedicated cross-functional team, or at least 50% of them, and that's good. So kind of almost like a pure 50-50 split, which is pretty par for the course about what we see just industry-wise. So we can move ahead to the next slide. So digital transformation overall usually is happening in a couple of broad categories. If you look at this risk, adoption of digital technologies requiring new skills in short supply, there's kind of the bucket of, hey, we want to find better ways to engage with the patient at both our physical locations, but also virtually. And so you see a lot of digital technology investments around telemedicine or telehealth or wearable health devices or mobile health apps, stuff like that. And then on the other side of the coin is kind of the inside out view, which is like we're looking at streamlining frontline jobs, related to some of the practitioners like doctors, nurses. How do we be more efficient? That's some of the technologies related to getting better about getting data in and out of the EHR systems, translating that data into insights, smarter automation, smarter equipment, and then different automation technologies. And then, of course, the big elephant in the room these days, the AI and machine learning space, which is generating a lot of buzz. And so a couple of quick stats for you on the AI side that I think you might find interesting. So I just captured these last week. These are two of my favorites, but one is the implementation of AI reduced around 20% of physicians' time in administrative cases or administrative tasks. So if you think about what could happen with that extra 12 minutes of every hour spread across all your physicians, pretty significant financial impact. The other one was more the inside out, and was even more kind of stark, but it's 90% of hospitals would use AI in some way for either early diagnosis or remote patient monitoring of some type. So AI is definitely here to stay, and how you decide to deploy that is something I'll give you a little tool to go over and review post this webinar. But if you go to the next slide, I wanted to give some practical examples, and I'm going to go through these pretty quick in terms of how to alleviate some of these risks. First, research and experiment. So part of understanding the power of these digital technologies is really trying to understand what they are good at and what they are not good at, and really having a way to access those. So we're starting to see some clients now allocate time, like say on Fridays, spend 2 hours, bring in new vendors with new technologies. Each has 30 minutes. They get exposed to it. Their job is to tell them how they could apply to your business. And it just keeps it fresh. Doesn't have to be every week. Some people we're talking to are doing it once a month for maybe a longer bit of time, or every couple of weeks. But there's new, probably the number of new startups in the digital tech space in the healthcare industry exceeds the birth rate. I mean, there's new ones every week that I hear about. And so keeping up to speed with those can certainly help you. Imagineering the possibilities. So this is really where you take a technology by itself is not going to impact your business process. You have to bring in some and smartly leverage some of the front office folks who are dealing with patients to try to figure out, all right, how would this technology make either our jobs or our patients' lives easier? And that can sometimes be easier said than done. Some people are doing from the front side, looking at technology and trying to figure it out. Some others are going from the other side and saying, hey, what are the biggest problems we have? And that'll help us search for the right technology to look at that we should deploy. But just trying to imagine what that possible future state could be can help you guide on the technology choices, but also the skills you need to build. Resource roadmap. Too many times I see clients that are looking at one particular digital transformation initiative, but they're only looking at that one versus the set of other projects. And so what happens, it creates bottlenecks in resources. So a lot of times you go into somewhere, it's like, well, we've got a bunch of half-completed projects, and how come? Is because everyone was counting on this small number of technical resources to help them out. And so trying to have a more integrated look at the resources that are tied to your initiatives is really important. And then organizational execution, like how do we execute all this stuff? If you do the resource roadmap side, that'll help inform you on the execution side of this house to say, hey, we need to hire this type of talent, or we need to find contractors, or we need to leverage our partners more if we really want to accelerate these initiatives. And so a lot of models that are emerging are more like center of excellence models, a lot of them around AI, some of them around broader digital transformation, looking at different partner co-creation models where you have a partner or two with maybe a sandbox where they can maneuver in data and try different things in your environment. And then finally, stronger university relationships, not only in trying to leverage the universities for all the skills that they potentially bring to the table, but these guys are getting out graduates that I think the healthcare space is going to have to compete a little harder on to get the types of skill sets they need on some of these digital initiatives. And so these are just some practical examples we see. I'll leave you with a final slide on AI specifically, just because it's such a hot topic that we get asked about all the time. But for the folks who are getting some of those results that I shared earlier, they're really taking a more thoughtful approach to the impact that AI could have on their business. And there's all kinds of frameworks out there like this. This is just one, but I just encourage you to use through it. And you don't even have to look at all six, but just think through and see what kind of answers you get to some of these questions. We're really seeing that it helps folks prioritize their AI initiatives. So at the end of the day, they can help their employees and patients both get better results. So I'll kick it back to Richard.
Thank you, Bryan. Appreciate it very much. This is certainly a hot topic. So with the time we have remaining, let's take one final look at the top risks for 2024 and 2034 side by side. And as you're just kind of perusing this list, we'll go ahead and begin the Q&A session at this point. And Bryan, I'm going to come right back to you with questions. And as a reminder to the group, the audience, use the Q&A function to add any additional questions you'd like me to pose to our speakers. And then as a reminder, you'll have access to these speakers after the webinar should you want to just reach out on an individual basis. That would be totally appropriate as well. But Bryan, kind of first question to you. I mean, do you have any specificity on what companies might be doing to build digital skills amongst their existing workforce?
Yeah, for sure. I think a couple of different things, Richard. First, and I kind of alluded to it in the last one, but we're starting to see the scarcity of skills lead folks to more of that center of excellence organization construct, because it's kind of like one of my favorite quotes from Star Wars is your focus determines your reality. But getting that focus on both enabling projects also enables you to help with the training aspect of it. Finding out, okay, these skills are going to be most practical for us. It can guide different training curricula that can be developed. And kind of as a corollary to that, and this is something that's emerged recently that I found really interesting, but in addition to more traditional learning and development programs, we're starting to see more organizations embrace something called microlearning, where folks can absorb really quick lessons, like maybe 10-minute lessons on a particular topic and kind of progress through a journey, but can start to build real skills that way, especially if we're trying to incent, frontline employees are extremely busy most of the time anyways, to try to adopt and learn a new skill. So that kind of balance of the old and new, and then the focused energy towards let's focus on the types of things that are going to be most impactful to our organization versus trying to take on either too much, which is unreasonable, and just spread your resources too thin. I think that's the thing that we've seen both be most helpful here recently.
Very good. Thank you, Bryan. Okay, Kim, I'm going to direct this next question to you. How are we seeing organizations kind of balance the hiring practices between new graduate clinical staff and experienced staff, et cetera?
Yeah, thank you. So the area of focus has really been around the promotion of hiring more experienced staff. And yet at the same time, we don't have enough experienced staff to meet the demands. So really requirements are that organizations now have in place new graduate programs with sufficient training, onboarding, and really kind of shepherding them through the first year or two. And that's going to be, I think, incredibly important. I know in the Dallas-Fort Worth area that there are a number of new grad programs, and really having a focused group that will manage that program is essential for making sure that it works really well. But I do think that we're going to continue to see more of partnerships with universities and colleges is another area for bringing in really those new graduates and being able to support colleges and universities in being able to actually have more student availability slots. So we're seeing a lot of that occur as well.
Very good. Thank you, Kim. And probably time for just one more, given a few wrap-up things that we need to communicate. But Bryan Neaman, coming back to you here, just kind of what you're seeing today, would you say healthcare leaders have more of an optimistic or pessimistic outlook from an economic perspective, at least over the next 3 years?
Yeah, I think it's mixed. I think it's based on, I mean, obviously it's based on geography, based on the competitive environment in that geography and the trends. But I would say, generally speaking, there is, if I had to have a bias, there is a little bit more optimism versus skepticism because of just the nature of just the population increases in general and just the technologies that are in place now. And there is pent-up demand for healthcare services, including elective services.
Yeah, I think that's fair, Bryan. In fact, many of the studies that we're looking at performed by others, are indicating the healthcare industry is staged for pretty substantial growth between now and 2026, and then even more so between 26 and 2030 with the aging of the population, et cetera.
Yeah, absolutely.
Yeah. Very good. Okay, excellent. Thank you. And, I think, Jarod, let's move to the next slide. I just want to share with the audience here. We can see here on this next slide that there are a multitude of other resources available that speak to these top risks, including a report with detailed commentary that will offer perspective on each of the top 10 risks we talked about today and others. That is available to the audience. Speaker bios will be included in the final materials that you will receive via email should you want to reach out to anyone directly. And then a number of other things you have access to through blogs and our website, et cetera. But Chris, unless you have anything else to add, I would just like to say a huge thank you to the audience for joining us today. Thanks to our speakers, and thanks to the DFW Hospital Council for hosting this webinar, and hope all enjoy the rest of their day.
Thank you, Richard. I want to let everyone know that we did record the webinar, and it will be posted online tomorrow, and we will send the link to all registrants. And Protiviti did such a great job. Thank you to everyone in this all-star lineup of speakers and putting this terrific presentation together. Thank you so much.
Thank you.